Hi, my name is Lito. I'm a permanent makeup artist and trainer of International Academy S. Today we will talk about laser removal of old permanent makeup with Julia Kyle.
Thank you. My name is Julia Kyle. I'm an advanced clinical esthetician and the owner of European Facials and Company, as well as a trainer of Skin Reality.
Julia, please tell me about when the client have do laser removal of old permanent makeup.
There are quite a few reasons why people remove old makeup, permanent makeup in particular. Sometimes pigment fades, sometimes the job previously was done is not actually a good job and people would like to remove it simply because they need to create better brows, lips, eyeliners, whatever we're talking about, right? So in that case it would be done before correction. Sometimes as we age, for example, especially for brows, our skin starts sagging and the brows go down and then we have this angry kind of tired look. So in that case we will remove the makeup specifically to create a brand new brow, to open the eyes that way, as well as shape of the lips, colors what are in fashion change. Hair colors change as well. If we create the brow, let's say for a beautiful blonde, and later down the road she decided to be a redhead, most likely the color what was chosen before wouldn't be an accurate one, so we would need to do correction, and for that I would step in and do the removal. Very often it's unfortunately by low qualified people, or maybe in other countries unfortunately we have situations when the pigment wasn't a good quality or it was done improperly, which means what as a result we may end up having blue brows, orange brows, cases where you can't cover up that work with new permanent makeup. I'm sure you've seen that in your practice a lot, and this is exactly the case when you usually send people to me and I do the permanent makeup removal so you can create a brand new beautiful work.
I would like to add that sometimes our client have gray eyebrows, and why it's happened? Because fading happens with red and yellow and we have gray eyebrows, and sometimes we cannot cover up and do cover up technique. I recommend for my client first of all to do laser removal and then to book an appointment to do a permanent makeup procedure. Is it right? What do you think?
Thank you. You are absolutely right. There are situations when you simply can't cover it up, and gray is one of them. That's when I see clients probably more than anything else. The gray brows would need to be removed before the beautiful new work can be done.
Cover up technique, it's technique when we're doing cover up with corrector. It's special mix of the pigment of red and yellow. It can be more orange colors, and it's very useful for gray eyebrows. And if we cannot do cover up of gray eyebrows, then I recommend to book an appointment for laser removal. Julia, how many procedures of laser removal do we need to do to remove our old ink of permanent makeup?
What a great question. Funny enough, I actually don't have an exact answer. It really depends on a few factors. First of all, how long ago were those brows done? I had clients who, for example, had it done months ago, hated the results, and were removing it all. We needed one, maximum 2 treatments. I had situations when it was over 10 years old and the pigment was so deep in the skin, it took us closer to 10 treatments to properly remove the pigments. So unfortunately we can't give an exact answer, an exact promise, but the guidelines would be the younger, if I can call it this way, makeup application, the less appointments you will need. The older and more stubborn pigment we're dealing with, the more appointments you will need.
Julia, what is the frequency of the laser treatments?
Frequency of permanent makeup removal is about once a month. So we are talking about 4 to 5 weeks in between the removal. The reason for that is very simple. As any laser treatment, especially permanent makeup removal treatment, what we're doing, we are basically creating a burn of the skin. It's a topical trauma. It needs to be healed topically and internally. On outside of the skin, it takes about a week for the wound to close because we are creating a minor burn, and then about 2 to 3 weeks internally to make sure everything is healed and functioning properly, because it would be kind of dangerous and can create a scar tissue if we go into the freshly removed pigment sooner than a month.
How does the skin heal after the laser treatment?
Healing of the skin is actually quite a roller coaster for the client. We go through few stages. First of all, we have erythema, swelling of the skin after the treatment, because it is an invasive treatment. That's normal. It's very important to pay attention if erythema lasts only for a day or two or persists longer, because if it's longer, there is a chance of infection, which can happen if you are not properly taking care of your brows after the treatment or any other area per se. As well, after erythema, we have crusting. Another thing, just like if you cut your finger or you burned your hand while you were cooking, you usually get a little bit of a crust. Some clients I noticed have it more pronounced, some clients have it less pronounced, but one way or another you will have a minor crust, which will go through the normal healing process, what will become itchy and uncomfortable. Super important not to pick that crust, simply because picking of the crust too early can create the scar tissue, which number one would be unpleasant to look at, and number two would be harder to fix when we are doing the touch later. Next, after the crust is gone, very first thing people think, oh my gosh, this is amazing, the color is gone, I love it. And that's actually not the case. It's gonna take few weeks for the color in the skin to go up the dermis and epidermis and be visible again. That's why we usually require more than one treatment to make sure we take color again and again and again out of the skin. As I said, we're lucky if it happens only once. Generally, it's more than one treatment. So when the color comes back, it's not as bright as before, and now we can see, okay, we can evaluate how much more will we need. Did it fade just a tiny, teeny bit, and we will have to go a little bit more aggressively next time? Or their illumination is like 50%, and then I can basically say to my client, we maybe need just one, maximum 2 more treatments. But the whole process is unpleasant because it's your face. It's itchy, it can be swollen, can be red, crusty, really trying not to pick stuff. It's just unpleasant process. However, down the road, when you remove something which shouldn't be there and you can create a new work later, it's all worth it. Basically, no pain, no gain.
Does the laser removal hurts? Can we use numbing cream before the procedure?
Absolutely. A lot of clients prefer to have the treatment with the numbing cream. There are few ways to do it. You can purchase your own 5% lidocaine cream at any local pharmacy and apply it for about an hour before you come. You can use my services as a clinical esthetician. I can apply topically 10% lidocaine, and it only takes half an hour. There are occasional person who says, no numbing, I will be good. And you know what? It's fantastic, but their pain tolerance is so amazing, because then the actual treatment goes faster and you don't have to wait. But I would say it is a rare occurrence. So to sum it up, I would say yes, it hurts. However, as any pain-related treatment, it depends on the personal pain tolerance. Some people can handle way more, some people can handle less. I also noticed what it depends on the area we're working on. If we're working on the lips, absolutely numbing cream. I don't even want to argue with my client. I think it goes way smoother for them, and it's way more beneficial if we are using a numbing cream. Brows, I would say 50-50. It's up to my client. If they would like to use it, some can handle it quite easily, some not. Eyeliner, once again, absolutely must be used. Another very sensitive area which we have to do. I also came across freckles. Freckles where, you know what, most people can handle it without numbing cream, except of the nose, because on the nose, nerve endings are so much closer to the surface of the skin. It's a little bit more painful, but on the cheeks, cheekbones, just fine.
Just an explanation. In North America, it's very popular to have freckles, like bird makeup freckles on the face, but it's not popular in Europe and Russia. On the market, we have now laser treatment and also removal. Removal can be salt and chemical. What do you think about this type of removing of old bird makeup pigment?
What a great question, because my clients ask me this all the time. So what is actually better? What will give better results? How does it work? Can we combine it? Why? How? It's a fantastic question. Thank you so much. So laser removal works quite deeply and actually quite safely in the skin. And the YAG laser is specifically, it's a true laser that goes with the beam directly into the skin, recognizing the pigment and working just on the pigment. And the skin around it is not affected, which is one of the most important things where we're talking about safety. It's also fast. As we talked before, we had situations when only 1-2 treatments needed to remove the pigment. Very rarely we need to do more. So in that case, we can achieve desired results just in a couple of months, which is, I think, quite nice. The removal using different chemicals or a salt substance works slightly different, because first of all, it's injected into the skin. We can guarantee the distribution if it's only going to affect the pigment or the tissue around it. And there are, especially when we talk about acidic chemical combinations, there could be some drastic changes to the skin internally and externally, from severe burns and scarring. Stuff like that could be quite dangerous. In my opinion, when we come to a very stubborn pigment, as I mentioned before, I had one client in particular, it took me literally 10 appointments to work with her brows. In those cases, stepping in with another type of removal, working deeper, complementing them with each other, we can. However, that would be a very unique case in my opinion. Generally, laser is more than plenty. Once in a while, as I said, we can combine them, but we need to remember, first of all, safety of those combinations, and second of all, if we do just chemical or salt removal, it can take a very, very long time. And I think in the modern life, the speed of our life and the desire for instant gratification, or just simply to get results faster, is more important in that case than waiting a year or even longer to receive what you want, removal of the pigment.
Julia, what possible side effect after the treatment?
Any treatment can possibly have side effects. When we are removing pigment of the brows, one of the most famous one is frosting. It's when the crust actually looks white. So for some people it's shocking. Oh my gosh, now I have white brows. It is a temporary thing and it will disappear slowly till we do the next treatment again, and it can potentially happen again. It is very easy to handle, to be honest. The scarier one is the color inversion on the lips. Depending on the chemical combination of the pigment that's been used on the lips, we sometimes have a different side effects, a color inversion. So while we are removing it with the laser, what can happen is the pigment originally, instead of frosting like on the brows, instead of white, will actually turn gray and or black. Some people, unfortunately, some technicians, unfortunately, don't explain it to their clients, and you can imagine the shock if, let's say, a few days later after the treatment, you wake up, come to the mirror, and see you have black lips. That is very shocking, and obviously person needs to be warned. That's why generally when we work on the lips, we first do a test. Literally, we use a tiny area in the corner of your lips, so it's not as drastic or as scary. We're doing a little removal there. If the pigment turns black or gray, you have an option to say, you know what, I don't want to do this, or I would prefer to use a slower or more dangerous methods as using chemicals, if we're talking about danger, or process-wise, length-wise, talking about salt removal, then it's an option for that client. Some people say, you know what, I don't care. There is a tons of lipsticks, I can cover it with temporary. However, before you can cover it with the lipstick, there would be time when you're not allowed to cover it. That's another important thing some technicians don't cover. So in my opinion, it's super important to explain your client possible side effects, to let them know what to expect, what can happen, so there is no shock, but there is no scare one morning, because these things are potentially can happen, and our job to walk you through, to hold your hand and make sure you're satisfied with the result and understand the process of the removal and the side effects again.
What possible consequences if the procedure done incorrectly?
Unfortunately, incorrect treatments are quite popular around there on the market, and I think it's very important for the potential client to do research, to look not just in, oh my gosh, this is the cheapest place in town, or oh, they promised me, they guaranteed me results and free treatments. It's a great deal sometimes, and it's a great bargain, but you know what, very often great deals come with a cost. Their consequences we're talking about. It's very important to be aware what if things are done incorrectly, we can actually create scar tissue. You can burn literally a client to the point when it's bleeding, when skin can't heal properly, get infection in there, things like this. And what I always tell my potential client, please do your research, please read reviews, please look at the diplomas, please look at the education, please ask any question possible. If I can answer your question, if I can explain you what's going on, if I can educate you, me or anybody else, then you most likely go into a good professional. If the person just says, yeah, it's all gonna be good, I can take care of it, but doesn't give you proper explanations of the treatment itself, of the aftercare procedure, of the potential side effects or the consequences, what can happen, then maybe it's a good idea to stay away from those professionals. Maybe they're not quite professionals yet.
Julia, could you please explain aftercare process?
Aftercare is actually a very important part. It's not just what we do at the clinic, it's what has to be done at home. After all, it's a teamwork. Aftercare is crucial because that's how we prevent your skin from infections, that's how we prevent from forming scar tissue. So basically, what you need to do is to keep your skin clean and to keep it dry. It's very simple. Number one, especially in summer, if you're working in the yard and playing with your kids or something like this, and you have this habit to wipe your forehead like this, and imagine you have dirt on your hands, you can actually get it infected if we're working on the lips, or when you eat, if you didn't wash your face or your mouth properly after, you can get some spices in there, for example, and create an infection. So it's being careful this what can come in touch with the area which is treated, as well as products we use. In if any product, especially as we age, we use a lot of products that contain salicylic acid, retinol, AHAs. Those would actually create double burn, which can cause hyperpigmentation. It can also create scar tissues, Picking, I mentioned that prior a little bit. It's important not to pick the crust when it's healing. Once again, we can create ice pick scars. Not a fun thing. It also opens the wound for infection. Not a fun thing at all. So most important, use the product your technician gave you to apply topically to protect your skin from exposure to the elements, whatever it is, dirt, sun. It's quite important to protect your skin. And number two, keep it dry. Never rub the area we worked on because you can accidentally pull off the crust we just created. Just pat it dry. And another thing, sometimes we feel a little bit like that, especially in the first couple of days when we're dealing with the inflammation, with the erythema. You feel like, oh my gosh, I need to put a cold ice pack on, and you can actually create a frostbite doing so. So maybe a better idea, take a hair dryer, use it on a cold setting. It's gonna feel quite nice and pleasant, and we are not creating any problems down the road. So aftercare is simple but important.
Julia, thank you very much for answering on all our questions about laser removal.
My pleasure. I actually have to thank you for giving me the chance to show my expertise and to show my knowledge, and hopefully to prevent incorrect treatments and hopefully guide clients the way they should be guided. Thank you so much for trusting me and having this interview together.
Thank you for watching this video. I think you find it very helpful and useful. Please like this video, subscribe to my channel and subscribe to my Instagram. I will also put link on Instagram, Julia, and you will find this below. See you soon. Bye bye. See you soon. Bye bye.